Well, the reason why I'm involved in this is because of a terrible tragedy that happened to us because of my son took his own life. And I just want to do little bits that in his memory, not big things, just small things that would sort of make me feel better about his life and just to remember him. He was a fantastic individual. He had lots of friends. He had so much talent. He was a great. He loved snowboarding. He was a gymnast, and nobody would recognise that he had a mental illness. And he didn't want anybody to know. His friends, his family, stigma impacted on him and made his condition quite a lot worse than it might have been without the stigma. So it had a tremendous impact on the way he thought about himself. And maybe it's a personality issue as well, because he's very self-conscious about what people thought about him. But having a mental illness, reinforced that. He was really very, very worried about what people might think if they knew that he had a mental illness. So he was the opposite side of stigma is shame, and he just felt ashamed that he'd been given that label. And so it was difficult for him to get help as well, because he didn't want to admit that he had this mental illness. I didn't tell anybody that I had a mental illness, so the stigma affected not just him, but it affected us as well. It was very difficult for us to go and talk to other people about our experiences as well and how we were struggling. So we did talk to our very close family and very close friends, but it was something that he didn't want anybody to know. And the irony is that they would have given him so much love and support. All his friends, all his family, they loved him. But he couldn't face up to the fact that he had this label. And it stopped him getting, I wish we could have done more to help him get over that and to receive more help than he was getting. He was a delightful personality. He was very compassionate and caring for other people, but he internalised this stigma and shame. And actually, one bad flaw he had was that he also stigmatised other people with mental health problems, because he internalised it and then projected it out again. And so when I went for an appointment with him, an outpatient appointment, he would sit there and say, recognise the loony, because he didn't want to be associated with people with mental health problems. So he internalised it and projected out and was stigmatised other people himself. Because it was very uncharacteristic of him, but it affected him so much. That's what he did, and that's made it more difficult for him to go and seek help, because he didn't want to be associated with people who have that label. We don't feel as though we could have done much more than we did. We helped him a lot, and except for that one thing, when thinking back, is could we have done something more about this stigma thing? I think the root of Ben's feeling of shame was was a public image about mental illness, because his friends would have come and supported him, his family would have supported him and loved him, they wouldn't have felt anything bad about it. But he's just had this internalised image from the publicity, from what appears in the media and the paper, that sort of general image about mental illness and all the words that used to describe mental illness, like crazy or lunatic, all the disparaging terms that affected him as an individual. And his self-esteem was quite fragile anyway. He was always very self-conscious. Yeah. So it's that general image, not what his friends or family would think, but maybe he did think that they would think that. Yeah, without that stigma behind it, I think he would have had a better chance of recovering.